Okay. Oh. Like to call the House Health Full Committee to order, and would our members please sign in? All right, we have detected a quorum, and so with that, I'd like to thank.
You got to take the form up there. So you got to direct the clerk to open the vote.
Okay, clerk, can you open the vote?
Now everybody punch in.
Okay, everybody hit present. Over there.
Yeah, we're good.
All right. All right, we have detected a quorum. All right, thank you, members. I'd like to welcome all members and visitors and staff to the 2025 House Health Committee. We're going to have an exciting committee and do some good work for the state. Like for those in the audience or at home watching, to get to know our members and the members of the committee. And so we're going to take a little time here and introduce ourselves. And if you have any personal orders at that time, you can provide some personal orders, and I'll go ahead and get us kicked off here. I'm Dr. Brian Terry. I represent District 48, which is the eastern half of Rutherford County. My district includes some inner city Murfreesboro, some of the suburban areas of Murfreesboro, and a lot of rural areas around Rutherford County like Milton, Lascassas, Kittrell, and Christiana. My district includes MTSU, Amazon, and the monument for the exact geographic center of the state, and soon to be home to the new Buc-ee's. So with that, we're going to go down the list here. Chairlady Haynes, you're recognized.
Thank you, Mr. Chairman. I'm Esther Helton Haynes. I represent District 30, which is part of Hamilton County. I also represent an area that has Little Debbie snack cakes. This is my fourth term in the Health Committee, and we're looking forward to a great year. Thank you, Mr. Chairman.
Yeah, thank you. You're recognized.
Good afternoon. My name is Iris Rutter. I'm serving my fourth term. I represent the 39th District, which is Franklin County and Marion County. Franklin County is home of the University of the South, and Marion County is Lodge Cast Iron Cookware and beautiful Bolt Tree Farms.
Representative Capley.
My goodness. Thank you, Mr. Chairman. Hello, everyone. My name is Kip Capley. I represent the 71st District in the House. I am the youngest member of the General Assembly, and I'm just happy to be here. Thank you.
Thank you. Representative Gant.
Thank you, Mr. Chairman. It's good to be back. I took a 2-year time off and went to help Mark in education, and so I'm back to health now, and good to be back after 2 years. Ron Gant, represent District 94, which is Fayette, part of Hardeman, and all of McNairy County, and blessed to represent that district.
Chairman.
Yes, sir. I'm Brock Martin. I represent District 79, which is Gibson, Carroll, and Henderson counties. I've in my second term, and healthcare is my favorite topic. So I'm excited to be on this committee. Thank you.
Chairman.
Representative Tom Leatherwood. I represent District 99. So I'm 99th out of 99 here. But my whole district is in Shelby County. I represent Northeast Shelby County, and it's a pleasure to be back this General Assembly and to be serving on health. Thank you.
All right. Representative Sherrill.
State Representative Paul Sherrill, 43rd District. It is an honor to be here today, representing the 43rd District, Warren and White County. Warren County, if you need some good nursery, come to Warren County. It's a national capital of nursery. So thank you.
Chairman Kumar.
Thank you, Mr. Chairman. Sabidak Kumar, I represent District 66, Robertson County, which is located immediately north of Davidson County and Nashville area. So we pride ourselves as minutes from Nashville and miles from ordinary. Thank you.
Thank you. Representative Travis.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. It's always good to be here with you on this great committee. I'm Ron Travis, District 31, which is Sequatchie, Bledsoe, Ray, and Van Buren counties in East Tennessee. This is my second year on your committee, so I look forward to it again. And I'm just glad I'm here.
All right. Representative Brooks.
Hi, my name is Shondell Brooks, and I represent District 60, Hermitage, Old Hickory, and Dawson. I'm the newest member here, and I'm excited to be here.
Thank you. Representative McKenzie.
Thank you, Mr. Chair. Sam McKenzie, District 15, which is part of Knox County, has the city portions of East Knoxville, South Knoxville, University of Tennessee area, downtown, and then what they call Mechanicsville, Lonsdale, Beaumont. It's kind of inner north, right near Knoxville College. It's my first time being on Health Committee, so I'm excited and I look forward to the opportunity. Thank you.
Thank you. Representative Hammer.
Thank you, Mr. Chairman. Caleb Hemmer, State Representative in District 59. This is southern border of Davidson County. Honored to be serving on the committee for a second term. I've got more healthcare practitioners in my district. As actually number one in the profession in my census data, and love health policy. I'm glad to be here.
Thank you. Representative Mitchell.
Yeah, thank you, Mr. Chairman. Bo Mitchell, I represent District 50. I represent Bellevue, Jolton, Goodlettsville, Charlotte Park, and part of Westmead. Thanks.
Representative Hill.
Thank you, Mr. Chairman. Timothy Hill, Third House District, Olive Johnson, part of Carter, part of Sullivan, and part of Hawkins County.
Thank you. Chairman White.
Thank you. My name is Mark White. I represent the 83rd District, which is Shelby County, parts of Memphis, Germantown, Cordova. My main focus is I'm chair of the Education Committee, so that takes up a lot of my time. I used to be on the Health Committee. I escaped for a while. They brought me back in for some reason. But really enjoy serving on the committee. There's a lot you learn on this committee. Being from Memphis, we have a wonderful city. I just want to point out we have Blue Oval City moved in West Tennessee, just 30 miles out of town. And Elon Musk picked us to put his XAI, which is considered in the future to be up to a $60 billion investment in artificial intelligence. So we've got a lot of good things going on in our community. We just keep on working.
Thank you. Representative Gillespie.
Thank you, Mr. Chair. John Gillespie, District 97. So I cover pretty much all of East Memphis with a little bit that Chairman White does not cover. And I just echo his sentiments. Happy to be here and a lot going on in Memphis, especially health related as well. So just happy to be here.
Thank you. Chairman Farmer.
Yeah, thank you, Mr. Chair. Andrew Farmer here, represent House District 17, portions of Sevier and Jefferson counties. With the Great Smoky Mountain National Park, Dollywood, you may have heard of it. Douglas Lake, downtown Dandridge, beautiful area. It's my second term on health, and it's a pleasure to be here, and I'm looking forward to working with everyone on this committee and under your leadership, Mr. Chairman. Thank you.
Thank you. All right. Representative Hicks.
Thank you, Mr. Chairman. Tim Hicks. I represent the northern part of Washington County. It's House District 6, and it's great to be here today. Thank y'all.
Thank you. Chairman Hicks.
Thank you, Mr. Chairman. And I'm the other Hicks of this Hicks clan that is on this committee. Represent Hawkins, well, the other part of Hawkins County that Representative Hill doesn't represent, as well as Hancock, all of Hancock, and part of Claiborne County. I do have a personal order, if I could, right quick, Mr. Chairman. I do have some family here, but not only is he family, he's also a Tennessee State Trooper, and certainly glad to have him in the audience. If he would stand and we could recognize Trooper Gavin Gillum. I'll just get that spit out. And thank you, Mr. Chairman. It's good to be back on the committee.
All right. And thank you for joining us, Gavin. All right, Chairman Williams.
Thank you, Mr. Chairman. As you said, my name is Ryan Williams. I represent House District 42, which is in Putnam County. I represent Allgood, Baxter, and Cookville, represent about 85% of that county, the home of Tennessee Tech and Ralph's Donuts. Check them out.
Thank you. And up front, we have Chairman Clemens.
Thank you, Mr. Chairman. I'm distracted by the donuts. John Ray Clemens, represent District 55. District is here in Davidson County, stretches from the Belmont University area over to Woodbine and then down to Antioch, home of the greatest families in Tennessee and the worst traffic. So I am proud to be back on the committee, Mr. Chairman.
All right. Thank you, and appreciate everybody joining us today. And we've got a few more introductions that we need to make. We have our committee staff, which we're proud to have working with us. Representative Clemens.
Thank you, Mr. Chairman. I just wanted to have a personal order, please. Wanted to welcome the Tennessee Families for Vaccines who are joining us here today. They were generous enough to visit us, our offices, and provide us with breakfast this morning. So thank you very much for being here.
All right, thank you. All righty, and so appreciate that, and want to introduce our committee staff that we have with us today. Our attorneys are not in the room with us. They are, it's bill filing deadline, and they have some important stuff to do, get these bills ready. So Heather Asbell will be working on our committee, and Jamie Shanks. Also, our research analyst this year, and which we had him last year as well, Mike Critchfield. The committee assistant down front is Megan Dix, and our committee intern is Maverick Emberton. And we have our committee clerks are Jennifer Andrade and Adam Bryant up front there. And then our sergeant at arms is Tommy Woodard. So thank all them for serving with us. We could not run this committee without them. We do have some housekeeping items that I need to go over to get us underway. So anyone not serving on the committee or on the committee staff is asked not to be on the dais 5 minutes prior to or after the committee meeting. And no member not serving on the committee may sit on the dais with us. Please keep in mind that everyone that will be presenting a bill will be given 5 minutes to present their bill. In the interest of time and fairness, time limits may be set on testimony relative to legislation. Parties interested in providing testimony on a bill should go to the link on the Capitol website and fill out the witness card in order to be put on the list to testify. We will follow House committee rules related to the number of times a bill may be calendared. The deadline for putting bills on notice will be 3:30 p.m. each Wednesday. All bill notices for full and the subcommittees should be turned in via the dashboard. I encourage all members, as soon as you get your bills ready, get them on notice. Amendments for the House Health Full Committee and Population Health Subcommittee are due by 10 a.m. each Monday. The Health Subcommittee amendments are due by 10 a.m. each Tuesday, and that's via email group or the email group House Health. Each member putting a bill on notice in any of the health committees will be asked to fill out a short informational form about his or her bill in order to help assist the bill through the committee's analysis. Obviously, this is not a requirement for the bill for any committee or for my staff or sub-chairs. It would be much appreciated if you did fill out a form that just helps us with the analysis and helps us the efficiency of the committee. And this form will be provided to the offices via email following the meeting. The budget hearings, we will have some of those later on in the year. Right now, today, we're just going to be doing an informational and meet and greet type of meetings today. And then lastly, this is about decorum for committee members and the audience. This committee is known for our cordial debate and decorum, and we will continue to uphold that high standard. Audience members are free to hold signs, but keep them below your shoulders so as not to block the views of others. Audience members are required to be in a seat and not standing. And the expectation, because of the standards for decorum, is that we will not have any outbursts or disruption. And so today's meeting is going to be introductions and practice. And as many, I don't know if those out in the audience know this, we have a new voting system. And so today we're going to take some practice votes. And so the clerks, if they can get the board ready for us, we're going to have a practice vote before we invite up the Department of Health and the Division of TennCare. So we're ready here. Okay, Madam Clerk, please open the vote. Okay. All right. All in favor? Nope. Have you got it on there yet? Do they need help? Are y'all able to get the vote up? Not working for us? Well, guess what? We are not going to be practicing a vote today. All right. All right. Well, that's why we have these, we're having this meeting to work out some glitches. So maybe we'll get that going at the end of the meeting. So without that, we are going to go out of session and call up the Department of Health. Thank you, Commissioner, for joining us. And since we have a new system, you don't have to push any buttons. I think we got it from up here.
Very good. Well, thank you much, Mr. Chairman, members of the committee. I'm Dr. Ralph Alvarado. I have the privilege to represent the best department in state government, the Tennessee Department of Health. I know there'll be some who'll want to argue, but I would argue that it's just a matter of fact. And Mr. Chairman, I'd mentioned the idea of coming before this committee to present what it is that we do in our department. And I realize that there are some new members in the General Assembly and also on this committee, but many experienced ones who may not fully know the breadth and type of work that is done in the Department of Health. And so I appreciate the time that we have been allotted to provide a rapid overview of what we do. I know we've been given 30 minutes, which is probably not enough time, but we're going to do our best to try to go through. And I can talk pretty fast, so I'm going to do my best, and our team's going to do our best. I'm going to let all of our members introduce themselves before we get started.
John Webb, Deputy Commissioner.
Deputy Commissioner J.W. Randolph.
Deputy Commissioner Dr. Toby Amison.
Tim Jones, Chief Medical Officer.
Mary Catherine Bratton, Deputy Commissioner and General Counsel.
All right. Well, very good. Thank you all. Like I say, I got the best team in state government. You know, I started this role about 2 years ago, Mr. Chairman, and I sensed that maybe at that time our morale for our department was a little bit down. Public health was just coming out of a pandemic, and we had some pretty rough years. We've all had a lot of transition amongst our staff during that time as well. But my charge to our team from the start has been a simple one: to go meet our communities where they're at, to listen, to be predictable, and to build trust. And the response really has been immense. These are just a few of the images of groundbreakings and ribbon cuttings we've gotten to do for rural hospital openings, project expansions, and a new and improved health departments all across the state, opening dental operatories and providing services to Tennesseans that are in need. Our department is one of the largest government departments in state government and touches almost everybody in the state. The department has about over 2,900 positions. About 2,700 of those are full-time, 214 are part-time. Our total budget this year is about a little bit over $1.5 billion. Normally, it's around the $900 million mark. 370.4 million of that is in state funds, 274.2 in other types of funds. This year, it's 868 million in federal funds, but that's typically between 240 to 250 million dollars. And again, a lot of the federal relief funding inflated our budget estimates by about over $600 million. So when I talk about what the department does, it also reflects our why. And I thought it'd be important to put our mission forward to protect, promote, and improve the health and the well-being of all people in Tennessee through our core values of excellence, service, compassion, and trust. Now, some of you may not be aware of the structure of oversight of our county health departments. The Department of Health, of course, manages the 89 rural counties with 6 metro health departments reporting to their local governments. Over the past couple of years, I've visited all 95 counties, almost all of them multiple times, and I've had a chance to see many of you during those visits, so I appreciate having met a lot of you. But we've received questions from some of you regarding our plans for project programming in some of these metro counties. So please know that although we partner with our metro counties, meet with them on a quarterly basis, and often fund many of their projects and programs, we do not provide oversight over those health departments. They operate independently and collectively, and they cover nearly half of the state's population. However, we do try our best to coordinate efforts to achieve the same goals, and we have also mobilized a lot of our staff when those county health departments are in need and request assistance. So in Tennessee, we take a lot of pride in our football, basketball, and our baseball rankings. We're also very proud of our burgeoning economic prowess and top rankings in taxation, growth, job creation, tourism, economic investment, and development. However, when it comes to our health outcomes, we are firmly in the bottom 10. And this is the last of the economic pillars that as a state, we must conquer if we hope to achieve our highest levels possible. So we aren't afraid to own up to our poor health outcomes, but we also know that we have the leadership, the knowledge, the resources, and the determination to make steps in the right direction. With your help and investment, I think we can improve this. Right now, the Tennessee Department of Health tries to partner with all state agencies. We partner with TennCare, the Department of Mental Health and Substance Abuse Services, which does an excellent job providing a lot of prevention and treatment in their respective spaces. Also, the new Department of Disability and Aging, and others, including Education, DCS, Department of Labor and Workforce, Economic and Community Development. We try our best to break down silos between departments. The governor has charged us to do that. And I often convey to my staff that if any other department achieves its goals, the health needle improves. So it behooves us as a department to also be interested in what other departments are doing. If they achieve good status, we know that overall health will improve gradually. And so it's important for us to see that other departments are also very successful. Medicine and public health have been two of the greatest forces for improving the quantity and quality of human life in all of history. And over the last century, we've gained 30 years of average life expectancy. About 25 of those years are attributable to public health interventions. Heart disease and cancer are still our #1 and #2 killers and are responsible for roughly 60% of the deaths most years in Tennessee and in the United States. But it's also important to know that if you compare to 1900, that back in 1900, there was very little obesity, there were very little processed foods, and there were no vaccines and no fluoridation of water. I know there's a lot of focus on that right now in a national debate, but we remind people that we want to get healthier from our food angle, from processed foods, yes, but even though when we had that at one time, there were other things that were factors that helped us improve and extend our life expectancy. We remind our communities all the time that we're all better off when we're part of something bigger than ourselves. And this is a study published in JAMA looking at the link between religious service attendance and lower suicide rates amongst U.S. women. And the findings in a long-term cohort study were that women who attended religious services once or more per week had a 5-fold lower risk of subsequent suicide compared with women who never attended religious services. Religion and spirituality may be an underappreciated resource that psychiatrists and clinicians could explore with their patients as appropriate. All this to say that it's important, regardless of our faith, to engage with our family, our peers, and to pursue something bigger than ourselves. A reminder for many of you in this committee, I know many of you are believers. You may struggle in finding a way to live out your faith in the work that you do in the legislature. Please know that the department is the department where you can live out the tenets of Matthew 25 to help the least of these. And our local health department is often the place where people turn to for help during a health crisis. So we're going to ask you to please consider that and consider investing with us. We also provide a lot of other things in our local health departments. We provide a tremendous number of services, all that you see in this list before you. We're the only state in the union to provide primary care services in our health departments. We operate 56 clinic locations in Tennessee, 16 federally qualified health centers. We also provide dental services, treatment for sexually transmitted infections, HIV, tuberculosis, family planning services, various immunizations, breast and cervical cancer screenings, and WIC, which is Women, Infant, and Children Program to provide nutrition for children. We house navigation services for people with dementia, care coordination for children and young families, Narcan or naloxone and fentanyl test strip distribution. We handle reportable disease and investigations, emergency preparedness, environmental health, and community health planning and engagement as well. In addition to those things on the local health departments, our staff is also fully engaged in a number of other activities statewide: disease prevention, vital records, oversight of professional licensure boards and investigations, providing and processing a lot of data, community engagement, running the state lab, restaurant inspections, maternal child health, engaging young people and older adults to support healthy aging across the lifespan, and so much more, Mr. Chairman. Again, 30 minutes is just not enough to talk about all this wonderful work that we're doing. With that, I'm going to kick it off to Dr. Jones, who's our Chief Medical Officer, to talk a little bit more about the things that are involved in his column.
Good afternoon. I'm going to start with community health services. This is basically the staff, the 2,300 staff that are out in those brick and mortar health department facilities in your counties, implementing a lot of the programs that you're going to hear about in the next few minutes. These health departments get about 870,000 visits a year to for all of the services that we provide. We have those 57 primary care clinics, and they get about 560,000 visits per year. That's obviously an enormous number of people and takes a lot of our resources and time. We also have 33 dental clinics that are open and had 20,000 visits last year. We have an additional 12 health department clinics that are ready to open their doors and serve patients as soon as we have dentists. We've had very high rates of unfilled positions in recent years, but there are initiatives now, many of which stem from the Healthy Smiles initiative, which has been funded for the past 4 years, which has really helped us recruit and be able to open our services in the areas of highest need. The next things I'm going to talk about are basically signs of the better things are going, the less you hear about us. The first example of that is communicable diseases or infectious diseases. We get about 250,000 reports of individual communicable diseases every year. Every single one of those is responded to in some fashion. Most of them get interviewed. We try to find out the source of the diseases and whether or not they're associated with outbreaks, which is what gets a lot of attention in the news, and you all hear about them frequently. And then we look into ways to prevent the spreads of those diseases. Of that 250,000, about 75,000 are sexually transmitted infections. Every one of those is interviewed. We trace their contacts and try to treat not only the patients, but those that have been exposed. And as you can see on the graph here, syphilis is one of the diseases that we are currently don't have good control over. This is a national phenomenon, so we're right in the middle of the pack. We have some proposals this year in the legislature to increase the amount of testing that's done in pregnant women, which I think is a very, very important intervention to prevent these syphilis in newborns. And that will go a long way to help address this problem. We also do things like rabies control, TB treatment, HIV services, and a variety of other sort of infectious disease controls. The next slide just shows the success of vaccines in the last 30 years or so. The colored bars show the number of lives, the number of deaths that were averted by access to vaccines. And you can see that about 150 million deaths were averted since 1974, and that's all attributed to vaccination. Our vaccine program currently runs the Vaccines for Children program, which provides about 800,000 doses of vaccine to underserved populations here in every year. We also have a very robust public health emergency preparedness program. We work very closely with TEMA and other agencies in responding to a variety of public health emergencies. That includes very recently the Helene response, where we sent out 6 healthcare coalitions and activated them. We deployed 7 strike teams all around the state and over 90 resources, equipment type supplies to the affected area. And we do this for not only floods, but fires like in Gatlinburg, weather events, and any other environmental type situations that are affecting the public's health. Environmental health, this is another one where if things are working, you don't hear about it, but every time you go to a restaurant and don't get sick, some of that is attributable to the 80,000 restaurant inspections that we do every year. We also regulate about 45,000 pools, tattoo parlors, hotels, food facilities, and jails, and inspect all of them the same way to prevent contamination and things that aren't good for you, bed bugs, things like that. And obviously, we have done a lot of work in the opioid and drug overdose area. That's one of the big scourges of our society in recent years. Again, it's nationwide, but unfortunately, we are one of the highest states in the country in terms of overdoses and drug use. A few years ago, we had about 1.4 prescriptions for opioids every year for every single man, woman, and child in the state. Meaning those of us that aren't getting it, it's even more prescriptions for others. That's an enormous amount. And it's come down very rapidly due to a lot of interventions, many attributable to recent laws like prescribing control laws, coming out with pain guidelines, monitoring prescriptions. And our programs have distributed about 28,000 doses of naloxone. It's available free in our health departments to anyone who requests it, either for themselves or families and loved ones that may be at risk. And finally, we have a large public health laboratory. It serves as a reference laboratory for all of the academic and private laboratories in the state. They do a lot of testing that's not available commercially. We do not only about 1.8 million tests for infectious diseases, but also have the capacity to test for radiologic specimens, environmental testing, and have the only bioterrorism laboratories in the state, testing white powders and things like that in large emergencies. And we are very excited that we have a new laboratory under construction to open in about a year and a half. Our current laboratory is sort of on its last legs, and we're very excited about going into this new facility, and it will increase our capacity and efficiency tremendously. So with that, I will pass it to my colleague.
Thank you so much. I'm delighted to be here this afternoon. I get to talk to you all about population health, and I'm a pediatrician, so this is something that's very near and dear to my heart. If you want to move to the next slide, optimal health across the life course is what I'd like to say that we do in my column. We have everything from WIC to our injury prevention programs, from health promotion to vital records. And so I'm going to go through some of these. You may be familiar with some of these programs. So starting off first with vital records and vital statistics, they are the ones responsible for the birth, death, marriage, and divorce certificates that all of y'all are familiar with. We get about 1 to 2 requests per day from various legislators. They handle about 13 million Tennessee records. They're required to keep all birth certificates for 100 years and death certificates for 50 years. In 2024, just if you've ever been to Andrew Johnson Tower, in their lobby alone, they've handled almost 23,000 visits. It's particularly busy right now. They've issued close to 900,000 certificates with 132,000 stakeholder requests being done each year. There's been a significant increase in our volume over the past several months, approximately 17% increase from the beginning of November till the end of December. And we attribute a lot of that due to the Real ID deadline that's coming up soon, as well as some of the federal changes that have happened recently. Moving on to WIC, that's our program for women, infants, and children. It was mentioned before, so it's done through the local health departments, but we do the administrative part here in downtown Nashville. And I always like to remind folks that WIC is not for formula. As a pediatrician, I only knew it for formula, but now I know that it's useful for helping counsel moms on nutrition, lactation, as well as if you remember the formula recall that happened a couple of years ago, we were very instrumental in that formula recall. We know that WIC is evidence-based in its efforts. It helps decrease infant mortality. It improves immunization rates for children and decreases pediatric obesity. And on the slide, I just wanted to show we have something called the WIC Shopper app, which has been a really big uptake from a lot of our patients. Over 95% of Tennessee moms and families who are on WIC use this, and it really helps reduce the stigma around WIC, but also make it easier for them to keep track of their benefits. If you want to move on to the handling perinatal emergencies, one of the areas underneath my column as well is injury prevention. So I think about two areas of injury prevention: maternal injury prevention, but also infant injury prevention. So specifically, the three programs I wanted to pull out are the Tennessee Initiative for Perinatal Quality Care, and that's handled through Vanderbilt. They do a lot of pilot programs that are initiated through Vanderbilt, but then rolled out at other birthing hospitals across the state. And they do things everywhere from simulation trainings to programs to make sure you're doing optimal cord clamping for babies post-birth. We also have our Perinatal Advisory Committee, which is legislatively mandated. They are looking into work around NRP training for EMS workers, as well as funding for our regional perinatal, or 5 regional perinatal centers distributed across the state. And then the last program I wanted to highlight was our Count the Kicks program. This has been a tremendous uptake in Tennessee. We actually broke the website when we started this, which we're really proud of, that we got to break the website. It's an app-based intervention that allows moms to be able to literally count the kicks for their babies. And it's been evidence-based to show that it decreases the rate of stillbirth in babies in the states that have rolled this out. So that just rolled out last summer. Moving on to safe sleep, we do have quite a few safe sleep interventions as well. Sleep-related death is the #1 cause of preventable death in children under the age of 1. We know that there are a lot of disparities in Tennessee in particular, but we also are working across the state with a lot of our partners to distribute a lot of safe sleep materials, including door hangers, tags. These are things that are distributed not only through our local health departments, but also to individual providers across the state. We are also able to provide pack and plays that go to moms who don't have a safe sleeping surface for their babies, as well as targeted PSAs for really aiming at multi-generational families. We've started learning a lot that grandparents, aunts, uncles are very often the folks who are taking care of these babies. And so just to make sure that we're targeting the messaging, not just to parents, but all the other caregivers in the home as well. One other area I'd like to highlight, which many of you probably have heard of, is our evidence-based home visiting program. This is done through 3 major state partners: Healthy Families America, Nurse Family Partnership, and Parents as Teachers. These are folks who are identified through the birth record or through their provider at home to really have someone come into the home. And this is a voluntary program where they come into the home and really surround that family with the support that they need, especially for those high-risk families. They teach parents about improved parenting skills and family function. They distribute things like the Dolly Parton Imagination Library to give kids books for those types of things, getting them linked up with social services like TennCare, WIC, and SNAP, as well as promoting early learning and safety in the home. One thing I would like to highlight is that a lot of our home visitors were going into people's homes and noticing unsecured firearms in the home. And in doing that, they were able to do some voluntary education around how to store firearms safely when you have small children in the home. Next. Our chronic disease and built environment groups, one area I'd like to highlight from them is from Scott County in Oneida, Tennessee. They work to do a walkability plan for the city of Oneida. And we know that when you have a walkability plan, that is something that that local community can take and start to establish things like sidewalks, safe lighting for peoples. And we know that when you do have increased walkability in a community, it decreases blood pressure, decreases the rate of diabetes, and decreases the rate of cancer in that community. Dr. Jones mentioned this before, but we have not only in addition to our local health departments, but we also have safety net clinics that are distributed across the state. The first picture up there is my friend Kristen East Martell, who is a med peds doctor, and she works at Siloam Clinic, which is one of our faith-based clinics that we help support. There are other local clinics, including places like Interfaith Dental that you may be familiar with, that do a lot of work in very low resourced areas. So it includes places like the federally qualified healthcare centers, our faith-based clinics, and also local health departments, but also places like our nonprofit rural centers, and then project access specialists. And those are specialists who volunteer their time to get increased reimbursement through our state programs. Areas that we're working on with this, if you want to move to the next slide, is our program called TN Strong, stands for Tennessee Stop Tobacco and Revolutionize Our New Generation. I didn't come up with the name, but it was a good acronym. It's a youth-led statewide movement that is really committed to raising awareness of the dangers of smoking, but not only that, to prevent kids from smoking in the first place. They work at the high school level, and the kids really become ambassadors back to their local communities to decrease smoking rates. They've worked to produce PSAs with smoke-free TN, and we're hopeful that with expanded funding, we'll be able to extend this down to the ages that really need it, which are those middle school ages. And then the final thing I'd like to talk about is our CHANT program. Our CHANT program is what I like to call our social worker light. I use it a lot in my clinic when I'm trying to refer a family to something and I don't know exactly where to refer them, but I know they need a panoply of services around them. And it is really no wrong door when we use the CHANT program. When you refer families to it, they get 17 different pathways that they can be taken in, anywhere from bereavement if a mom has had a perinatal loss, all the way up to dental, finding a medical home, finding smoking cessation, and other help and resources. So I always like to highlight that to folks as a resource for your families. If you're looking for something in your local community, please refer to CHANT. And with that, I'll turn it over to my colleague.
Good afternoon. This is J.W. Randolph, Deputy Commissioner. Pleasure to be with you all this afternoon. In every county for roughly 30 years, there's been a county health council. County health councils are a volunteer group which are led by cross-sector groups of your neighbors, friends, and families. Common representatives on health councils include chambers of commerce, agricultural extensions, veterans groups, education, recovery coalitions, congregations and faith-based leaders, senior advocates, nonprofits, and local mayors and elected officials. The purpose of these groups is to set a locally led direction to improve public health in their community. By conducting a county health assessment and a community health improvement plan, the council selects 3 shared priorities to improve public health. This systematic process is supported by TDH and our Office of Strategic Initiatives and has made Tennessee a national leader in putting local voices first in public health and supporting communities as they design health investments that are the right solutions for the community and by the community. Funding County Health Council implementation projects was the #1 recommendation of the Rural Healthcare Task Force to address the social drivers of health in Tennessee. Secondly, I want to talk about the Healthcare Resiliency Program. Tennessee had the wisdom to reinvest much of its COVID relief funding back into rural healthcare programs with more than $240 million supporting 90+ projects through the Healthcare Resiliency Program. These generational investments in healthcare services are supporting low-income, minority, rural, aging, and other underserved populations in more than 50 counties across the state. This program has meant so much to our healthcare partners in Tennessee that this body had the foresight to invest $50 million additional dollars from TennCare shared savings towards a new state-funded healthcare resiliency program targeted specifically towards help in rural communities. The application process closed in late January, and we've been delightfully overwhelmed at the continued enthusiasm for these high return on investment dollars going towards rural healthcare, once again designed by and for the community leaders of Tennessee. The Tennessee Department of Health strives to make our department the best place to work for folks in every community across Tennessee, and so that begins with our workforce. Our Office of Communications supports the department's public engagement work in media relations, public awareness campaigns, and website content management. As part of our strategic plan, the Office of Communications has directed 30% of social media posts towards highlighting work at the county and regional level. In the fourth quarter of 2024, the office developed and launched the Make Mondays Matter Workforce Development Campaign to raise awareness about public health as a rewarding career choice and excellent choices at the Tennessee Department of Health. Over 3 months, the campaign saw 64,500 unique visitors to the careers area on the department's website, interacting almost 90,000 times with pages about public health careers at the department. Additionally, in the last 2 years, we've doubled the number of applicants for TDH positions and the number of internships available for students growing from 45 to 81. Tennesseans 60 and over are the fastest growing segment of our state's population. In less than 10 years, older adults are projected to outnumber children for the first time in U.S. history. Alzheimer's disease is the 7th leading cause of death in Tennessee, leading to roughly 3,000 deaths each year. More than 130,000 people aged 65 and above currently have Alzheimer's disease or related dementia, with 370,000 individuals serving as their caregivers in Tennessee alone. A few ways that our department is supporting older adults and healthy brain development across the lifespan include, in October of 2024, we were proud to announce the launch of TDH's first Office of Healthy Aging, to promote partnerships and public health practices supporting the well-being of older adults and their caregivers. We've also established a state dementia director position to coordinate efforts across agencies and to give Tennessee a seat at the table with our national partners. Older adults and healthy aging activities are included in the Tennessee State Health Plan, our department's four-year strategic plan, and being incorporated in many local community health improvement plans with our county health councils. The Trust for America's Health Age-Friendly Public Health Systems program embeds age-friendly practices for adults 65 and up through accessible, inclusive, and preventative care across the lifespan. Their recognition program evaluates local efforts to ensure older adults are considered in county-level needs assessment and health improvement plans. To date, 29 county health departments are being recognized as age-friendly, and in 2025, we'll be working for universal recognition in all 89 of our rural health departments. Finally, we're training healthcare providers in early dementia detection and diagnosis through the Tennessee Dementia Echo program, establishing a Dementia Navigator program, coordinating efforts with faith-based organizations and leaders statewide on providing dementia and caregiving services through the Engaging Communities program with the University of Tennessee Chattanooga School of Nursing, and enhancing ETSU's multi-sector plan for aging dashboard to track metrics and trends, and wanted to recognize the leadership of Commissioner Turner and his team with the new Department on Disability and Aging as well, who have been really great partners. Finally, our column supports the Division of Health Licensure and Regulation, containing both health-related boards and the Office of Emergency Medical Services. Health-related boards provide administrative support to 38 boards, committees, and registries who are charged with licensure and regulation of their respective healthcare professions. As of December 31st, 2024, HRB is responsible for over 371,000 licensees in 108 different licensure categories. Our staff balance excellent customer service with an average growth rate of 8% a year, processing all initial, renewal, reactivation, reinstatement, and reciprocity licenses payments, continuing education audits, preparing for each meeting, and administering required examinations. And last but not least, the Office of Emergency Medical Services licenses emergency medical technicians, or EMTs, and paramedics, conducts inspections for all ambulances in the state, and is also responsible for managing the statewide system for EMS radio communications, which ambulances use to communicate with hospitals during patient transport. As of December 31st, EMS had over 25,000 licensees, inspects 210 ambulance services that operate 1,551 ambulances who make more than 1 million patient transports annually. And with that, I'll pass it to Mary Catherine.
Good afternoon. Thank you. Mary Catherine Bratton, General Counsel for the department. As General Counsel, I supervise a team of attorneys who provide legal advice and support to all the programs you just heard about. And through the Division of Legal Services and Enforcement, we also provide advisory attorneys for the boards that you just heard about that are administratively attached to the department. And we have a team of attorneys that represent the state in disciplinary matters before the board should a practitioner violate the Practice Act. What you may also be familiar with is we have a team of investigators. We are a complaint-driven system. And so anyone can file a complaint against a healthcare practitioner in the state, which is confidential. We have a team of 5 desk investigators, 4 field investigators in West, 7 in East, and 7 in Middle, based on the spread of where cases come in from, who are out in the field talking to practitioners, talking to complainants, and getting the story behind any complaints to bring back to the boards and let them make a decision on whether to assess discipline. We also have the Office of Legislative Affairs, who I want to make sure that you all know who we have here. We have Assistant Commissioner Holt Witt, who's in our audience, Legislative Liaisons Grayson Carter and Olivia Johnson. If you 3 could wave, I'm sure you all know their faces, but they are up here every day, and they're really here to provide you all support. They let you all know if we have any concerns about a bill, if something may not function the way that you understand it to function. They're here to give feedback and support, and also connect you to whatever resources you may need from our department. So there's some smiling faces that I'm sure you know, and we appreciate you giving them some time. Thank you.
Chairman, that's the fast version of the Department of Health in 30 minutes. We're open to any questions if you have the time.
All right, thank you. And I do want to be respectful of TennCare as they're coming up and respect their time. But do any of the members have any questions that they would like to ask? Martin?
Thank you. You're good. Thank you, Dr. Alvarado and team. Y'all have done a fantastic job. I know in rural West Tennessee, a lot of these things you're implementing, we're seeing come to fruition and making a difference. My question is kind of directly towards you, or directed towards you. Over the next 2 years, this 114th General Assembly, what is something that you think we could do to move the needle even more so for Tennessee in these health rankings?
Oh man, that's a
Just one
dangerous-
loaded
that's
question
a
for you,
dangerous-
but
that's
just
a
one thing.
dangerous question, Representative. I don't have the time to go through it all. I think tobacco policy is something that's important. Whenever I talk about our health rankings and people say, what are you going to do about being 44th? What's killing us is heart disease and cancers. What's the underlying cause of that? Is tobacco use, vaping use. Recent studies have shown that vaping, we've talked about harm reduction. That's a 2008 term. It's really no longer applicable. The studies all show that using vaping is equal to smoking as far as your outcomes of COPD, heart disease, cancers. If you use them together, that much worse. So you're going to hear a lot of the industry folks saying reduction. We got to do something to help curb that because we have an entire generation that's been rehooked on vaping, and it's going to cause a lot of deaths moving forward. Cancer screenings, lung and colorectal cancer. We do pretty good on breast and cervical. Lung and colorectal. We're working on aging populations as well. Obviously, infections, we constantly see those that we're trying to make effects on. Anything that's going to reduce people's use of needles or any kind of drug abuse, things that are going to potentially cause the spread of hepatitis C, HIV, anything that's going to help. We've got a lot of ideas on that front. So many things. I mean, my head is spinning, but I'd be happy to have a meeting and go through the entire plan of what we've got. I tend to bite, and then my team has to chew. And so often they're the ones that's the bandwidth, is how much our department can get done. But there are so many needs. Really, it's whatever we can do to help reduce heart disease and cancer right now will have the biggest impact. And we're going to see what's happening on the federal front. There's a lot of attention on food and what we're putting into our systems. Any kind of movement or change on that is going to help people in terms of being more active. Blue zones is another thing. Anybody who's watching or pays attention, I'd encourage you to Google blue zones. Sevier County is taking that project up. I think that'll catch fire in the state and have other counties do the same thing.
Thank you, sir. Appreciate it.
Thank you. Representative Clements.
Thank you, Mr. Chairman. And I was curious about the graph you showed with the vaccinations and the deaths that were prevented. It's pretty remarkable. And we've heard alarming reports about some things coming back as a result of decrease in vaccinations. So are we starting to see anything of alarming numbers that's starting to creep back into our schools, affect our children or any other population? I know I've heard some stories about various things, but can you elaborate on that a little bit?
Sure. Happy to, Representative. Thank you for the question. So what I'm doing around the state whenever I give a talk is anytime I talk to providers, I remind them of what these infections look like. Because if you start seeing decreased rates, we were a top 10 state on pediatric vaccinations in the country. We're now a bottom 10 state. So we've lost our standing on that. We're trying to achieve 95% status in every county, but I think 73 of our counties are no longer meeting that 95% threshold. There's a lot of discussion, a lot of worries. I try to encourage anybody that I talk to that people who have concerns, not to demean those concerns, not to dismiss those concerns. We need more engagement and discussion. It's an opportunity for us to talk about vaccinations, what they do, how they were formulated, how they were started. But we have seen a couple of measles infections in Tennessee that we saw from a student in Kentucky who brought it back, was out of the country, picked it up there, brought it back, exposed some folks. We had to contain some of those folks. We've had our first polio case in a long time in the United States. It's coming back. So I remind people things like diphtheria, which people don't know what that looks like. They hear about it. Diphtheria is like having an infection that creates a gray, thick membrane over your airway. It's like putting saran wrap over your airway and asking someone to breathe through that. You choke to death in that process. President Lincoln's son had diphtheria. Napoleon's wife, Josephine, had diphtheria. It didn't discriminate against anybody. It can be infected. It can kill. Those are things we don't want to see come back. It was a top 10 leading cause of death in 1900, and we don't see that on our list anymore because of all the vaccinations we've had. Pertussis and whooping cough is obviously still circulating constantly. We see older folks now getting that. Some of the immunity has waned over time, so they're recommending boosters for adults, especially the ones that are around children. But whooping cough is coughing so much that you stop breathing, you can't breathe and catch your breath in between, you turn blue and die. I mean, a lot of horrible things that we don't see anymore, thank God, but at one time was rampant in this country. Meningitis is something we don't see in children hardly anymore. There's quite a few of these the vaccinations that have been standard, but we are starting to see a few of those things break through, and we're hopeful that we can, again, if people are nervous, they want to have discussions, go talk to your provider and your doctor about it and determine what's right for you. But we encourage folks to have those discussions.
Thank you, Mr. Chairman, and I appreciate that. I was pretty alarmed to see that COVID-19 was the fourth leading cause of death in Davidson County, I think in the most recent report that I was provided by your department. And are you working with interdepartmental with the Department of Education? Because I assume there's a direct correlation with absenteeism in our schools across the state of Tennessee. with the decrease in vaccinations? Or, I mean, I could be wrong, but I'd be interested to see if there's any correlation there. So thank you.
I don't know if Dr. Amundson, if you have anything on the education. I don't know if you have a lot of, we're kind of limited a little bit in terms of what we can do in schools, obviously, but maybe you can comment a bit on that.
Dawn? Okay, thank you. I can just say anecdotally as a pediatrician, I have not seen any particular increase. My population of patients does tend to be very vaccinated though. There is some legislation going around. There's actually quite a bit of legislation always each year about vaccines. So I encourage y'all to look at those carefully. But no, I haven't seen anything particularly in relation to increase in vaccine preventable diseases yet. I think every year we do see whooping cough. I haven't seen measles in a while, but we did have those couple of cases. But we do see pertussis is probably the most common one that we tend to see frequently. And then in terms of our communication with the Department of Education, it's hard to get into the schools to do that kind of education right now.
All right, thank you. Are you, okay. We're going to be respectful of TennCare's time. We're going to have one more question. Chairman Kumar.
Thank you, Mr. Chairman. Just a comment. I think the question that Chairman Martin asked about what can we do to move the needle is really crucial, and that's the main thing. I would suggest to find time for Commissioner Alvarado, with his great knowledge, to come back and discuss that topic. There are things that you should do, and I know you're doing, and when do we expect to see the results? And there are things that we as legislators should be doing. What can we do? I think that'll be an important conversation, and I would recommend that we find time for that. Thank you.
All right, thank you. And at some point later on in the year, they will be back to discuss their budget. So we'll have a lot more questions at that point in time. I'm not going to ask you to respond to this, but I do want to bring this because I know you guys are dealing with this as well. You know, the AMA has talked about the physician shortage crisis, and so recruiting and retaining physicians, which I think for the safety net clinics and for the health departments, and it's going to be a big issue. It is a big issue, and so we're going to have to work together on that. So thank you for joining us today.
Mr. Chairman, thank you very much. Anytime, I'm more than happy to come and talk about health. Thank you so much. Appreciate it.
All right. Thank you. And with that, we will bring up the division of TennCare. All right, Director Smith, you are recognized, and we've got controls on the mics up here now, so you're going to hit this all a process for us. So you're recognized. Thank you.
All right. Well, thank you very much, Mr. Chairman and members. It's a privilege to be with you all today. My name is Stephen Smith. I serve as the TennCare Director. With me to my left is Dr. Victor Wu, our Chief Medical Officer, and to my right is Zane Seals, our Chief Financial Officer. And then we have a few others that are in the audience today. We've been invited by you, Mr. Chairman, to kind of give a general update of where we are as a TennCare program, and we very much appreciate that opportunity. Some of you may know that last year, TennCare in our state celebrated a milestone. It's TennCare's 30th anniversary. And our state has a long and complex history when it comes to Medicaid. It's one filled with both challenges and achievements, as we have strived to meet our mission of improving lives through high quality, cost effective care. But I'm very pleased to be able to say to you today that when it comes to our mission, TennCare is more successful today than at any point in our 30-year history. And that's not due to any one person or group or period of time, but it's many people working over decades to do that day-to-day work, make the tough decisions, to innovate, to manage efficiently and responsibly, and to build upon the work of the people that came before them. So that's multiple governors, leaders, legislators, partners, and stakeholders that really have worked together to take us from a place where the TennCare budget was literally going to take every available new state revenue dollar to one where today we have record investments in TennCare, and we also have record investments in public education and other needs of state government. And that is not a coincidence. It's why we take so seriously the idea that TennCare is much bigger than just Medicaid. When we consider our mission of improving lives, we truly believe that it's not just about improving the lives of the people that we serve in the TennCare program, but improving the lives of all Tennesseans. And what has been accomplished over the last 30 years, highlighted by really the last 6, it's remarkable, but it's an accomplishment of many and not just a few. Many of you are well aware of this, but I thought it might be beneficial to just level set a bit and quickly go over some of the basics of the TennCare program. So TennCare is a traditional Medicaid program. That means that we're traditional in a categorical coverage sense, meaning that we provide health insurance coverage to primarily low-income children, pregnant women, parents, elderly, and then individuals with disabilities. Today, we cover approximately 1.4 million Tennesseans. That's about 20% of the state's population. We cover about half of all of the births in the state each year. You all know very well that it takes a tremendous amount of resources to run a Medicaid program. Today, our budget exceeds $18 billion. That's an enormous amount of money. It represents almost a third of the overall state budget. It's about 23% if you look just at the state dollars alone. I have yet to meet anyone that disagrees with the statement that healthcare costs have risen and are rising at an unsustainable level. There are a lot of opinions and there's considerable discussion that's taking place right now, certainly at the federal level, about why that is and what should be done about it. But we as a state certainly have a role to play in that discussion. Of course, Medicaid is a federal and state partnership. We receive about 65% of our funding from the federal government. But regardless of that split, all of this represents taxpayer dollars. And so we have a responsibility to keep our cost trends to a responsible level while at the same time improving quality of care. And I'm not naive enough, we're not naive enough to think that one Medicaid program in the Southeast can solve our nation's healthcare cost challenges. But we should at least try to do our part. And that is what we have done. And a primary way that we have done that is through managed care. TennCare is a managed care Medicaid program. That means that we contract with health plans to coordinate care for our members and to create and maintain a network of providers. That also includes negotiating payment rates with those providers and contracting with those providers. The goal is to provide the right care at the right time in the right setting at the right cost. Tennessee was a leader in managed care many years ago, and other states have followed. In fact, today, almost 75% of Medicaid members across the country are served through managed care. I mentioned earlier how far TennCare has come as a program from those early days, and even in the last 15 years. This slide illustrates the program's evolution, one that was unpredictable and unsustainable with limited services, to one that is well managed and highly valued. Really, effective management is not an option for us. It's a must. If we do not manage well, we only need to look at our own history to understand that there won't be any resources left to meet all the other needs of state government and all the other demands of our citizens. It's again why we often say our mission is about improving lives for all Tennesseans and not just TennCare members. We've met that mission through effective managed care, but we've also focused on things like home and community-based services and value-based care where we pay based on quality versus simply quantity. On the subject of quality, while we have made tremendous progress when it comes to fiscal stability in our program, we've also made strides in quality. That is demonstrated by our performance on common and recognized national metrics. In fact, over the last 5 years, we have exceeded the national average in 56% of those national metrics. Now, we're not satisfied with that. We certainly have more work to do, but if you compare that to the previous 5 years, we hovered around the low 40s. So we have, again, more progress to make, but that is significant improvement. An important point I want to stress here is that it's not a coincidence that these quality improvements have coincided with improvements in the fiscal management and fiscal stability. And I bring that up because sometimes people assume that the cost-effective piece of our mission must come at the expense of high quality. But it's actually the opposite. They are dependent upon one another. It's cost effectiveness that leads to the available funding to improve quality of care. And then it's improved quality of care that actually leads to decreased costs. We've proven this with real and tangible evidence over the last 4 years with our latest innovation known as TennCare 3. As a reminder, TennCare 3 was implemented in January of 2021. It was a first of its kind waiver agreement that was entered into by the Trump administration and Tennessee. The impetus of this, of course, was a directive by the General Assembly and Chairman Hill. You know this well. This was a great example of collaboration between the executive and the legislative branches. But at its core, the concept of TennCare 3 was to try to move us away from a flawed financing model whereby the only way that a state Medicaid program gets more funding is to spend more money, and instead reward Tennessee for its successful and responsible management of our Medicaid program through additional federal funding known as shared savings. The basic idea here is that instead of our efficiency resulting in outsized savings to the federal government, we instead get to keep some of that money here in Tennessee and then reinvest back into our program to improve the lives of the people that we serve. Since the inception of this waiver, we have had the largest TennCare investments in our program's history, in our state's history, highlighted first by the addition of a comprehensive adult dental program. So that's 600,000 adults whose lives will be positively impacted and improved through dental care. In addition, we've had the goal of eliminating the waiting list for individuals with intellectual and developmental disabilities seeking services in our ECF Choices program. We received significant funding to attack that goal a couple of years ago. Thank you all for that. And we are now serving 2,300 more people. These record investments extend to our provider community as well, with billions in new provider investments, in addition to the negotiated rate increases through managed care. But again, all of these investments are made possible by our confidence to be successful under this waiver. And now we have confirmation, not just 1 year or 2 years, but now we have 3 years of confirmation that not only is TennCare 3 working, it is a resounding success. In just the first 3 years of this waiver, it's a 10-year waiver, but just in the first 3 years, we have achieved more than $900 million that we then can reinvest in ways to benefit the lives of the people that we serve. And that's exactly what we are doing in partnership with the General Assembly. In year one, we focused on the Strong Families Initiative that served an additional and is serving an additional 25,000 children, pregnant women, and parents. And now we are the first state in the country, the first Medicaid program in the country to provide diapers for families with a pilot program that is covering diapers for babies under 2 years of age. In just a little over a few months, we have provided, or 3 months, we have provided diapers to more than 40,000 babies across our state. For year two, we focused on two primary areas, rural health and behavioral health. The rural health investments included implementing recommendations from our Rural Healthcare Task Force, and those things target access and workforce development. And then you heard the Department of Health mention a second round of a very popular healthcare resiliency grant program, and that will target rural providers. And as the Department of Health noted, that application window has recently closed. And that program, again, is being administered by our sister agency. The behavioral health investment targets community mental health centers, other substance use disorder providers, behavioral health hospitals, children's hospitals, primary care, and others. The key point here is that we are focusing on areas where we see a direct TennCare need, and especially very complex cases where additional access and workforce and expertise are needed. And now we arrive at year three, and we have another very significant shared savings claim. And you all will see the plan for that when the budget gets released next year. But we were very proud to be able to utilize a portion of those year three shared savings funds, $100 million, to partner with TEMA to provide immediate help to the communities and Tennesseans devastated by the recent hurricane through the HEAL program. All of these investments from year one to year three are made possible by this waiver and the resulting shared savings, and they confirm the collective sound decision-making of our state regarding our Medicaid program over the course of the last 2 decades. At the end of the day, it's about improving health, which drives down healthcare costs, which results in shared savings, which results in our ability to reinvest those savings back into our program to improve health. So it's really a cycle. I will wrap with this slide. I started the presentation talking about how TennCare has never been more successful than it is today. And I can think of no better proof of that success than what our own members say about the services that they are receiving. As many of you know, the University of Tennessee conducts a survey every year of Tennesseans' satisfaction with their health insurance plans. And it's an effort to gauge their satisfaction with the TennCare program. This year, we are happy to report we have a 96% satisfaction rate. That is the highest that we have ever had. But it does continue a streak of about 15 years where we've been above 90%. And then last year, I think this is notable, for the first time in the survey's history, reported quality of care for TennCare households and their children met or exceeded reported quality of care for all Tennessee households, including those with private or commercial insurance plans. So that is in no way to suggest that we can't or that we should not improve. Of course, we should, and we're going to continue to do that. But I think that shows that we are doing something right, or at least moving in the right direction. That completes my prepared remarks, Mr. Chairman. Happy to address any questions that you all have, or hear any comments that you all have.
I appreciate that. All right, we are going to start a list here. I see Representative McKenzie, you are up first. Oh, give us 1 second. We're taking a list here. We got the controls of the mics up here, so you are recognized. There you go.
All right, thank
Working
you,
through
Mr.
the kinks.
Yes, I understand. Thank you, Mr. Chair. And I do have a question, but I know I'm out of order, but I would like to acknowledge folks that are up here for the Tennessee Credit Union League Conference, folks that I work with a lot on at ORNL Federal Credit Union. We have staff here, Chief Legal, Wendy Ward, and then Board Chair Randy Gorman, and Board Treasurer Joel Pearman. So let's give them a round of applause. But again, thank you for coming. Again, being new to this committee, I really appreciate the thoroughness of your orientation, I guess I'll call it. I know we're going to take a much deeper dive. But question, a general question. You know, I think no one's arguing the fact that this coming out of COVID for our youth, for our adults, for our seniors, there's a lot of mental health residual issues or things that probably were exacerbated by that and other factors going forward. I know you talked some about using some of those shared savings, but is there a plan to increase, the number of people that have access to that? Because I think there's a hidden portion of our population that need that care but just can't get to it.
Yeah, thanks for the question. So I would say that again, over the last 4 years, certainly we've made record investments in behavioral health, and last year we did have that $100 million investment. And that's spread over 5 years. And so it's not just a one-time deal. It's $100 million. It's not $100 million every single year, but it's $100 million spread over 5 years. And that's going to many of our behavioral health providers. I'll highlight our community mental health centers. And the whole key to that investment is to try to ensure that we have access for our Tennesseans that need that access. So that's designed to provide that access. And then I'll also point out that that really is in addition to the negotiated increases through our managed care organizations. And if you look at the last 5 years, we've averaged a 6% increase year over year over that 5-year period. So over a 5-year period, it's about a 30%. Now, that doesn't mean it's across the board, but on average, it's 6% for that 5 years. So all of that is designed to really address access. But I also will say that workforce and certainly behavioral health workforce is a challenge that every state is dealing with, and so we're not alone in that. We can't pay ourselves out of this. That's why I think working with our higher education institutions and working with labor and workforce development, trying to recruit individuals into this space is so important. And Dr. Wu, I don't know if you want to add anything to that.
Thank you. Victor Wu, Chief Medical Officer, and I appreciate the question, Representative McKenzie. I think Director Smith highlighted a lot of our really important workforce development. I think there's two parts to this puzzle. One of it is, of course, earlier identification of behavioral health needs, especially in those youth, adolescent populations that if you can catch them early, you might be able to help intervene and help get them into a good treatment. And of course, the second side of that is if you find those types of issues that are brewing or percolating, then you want to make sure you find a trained professional that can provide those services. And I think Director Smith highlighted some of the great examples. I also just note that, we've partnered with our children's hospitals around behavioral health. We partner with OB providers to really identify postpartum depression. So we're really supporting on the access and the workforce side, but we're also doing a lot of work on the education and trying to early identify these individuals. One of the things that we're really excited about is in partnership with pediatricians across the state, trying to help general practice primary care pediatricians more quickly identify some of these mental health issues such as anxiety or depression that can exist in the youth and adolescent kind of population. So there's a lot of activities occurring on both sides, both in terms of early screening and detection, as well as connecting to developing the workforce. So we hope to see and continue to support the growing problem that you identified.
All right. Thank you. Representative Hemmer.
Thank you, Mr. Chairman. Thank you, Stephen and team, for coming. I had a question for Dr. Wu. I've been doing a lot of research on maternal care in regards to, prenatal, postpartum care, and I've been talking with MCOs, with your office, Department of Health, et cetera. And, was alarmed reading a recent article about the high number of deaths in the TennCare population versus our private population, and was just kind of curious, what are some things TennCare is working on or we should be doing better? I know we've extended the care for the postpartum for 12 months, which should go a long way, but is it remote patient monitoring? Is it more education, screenings, et cetera? But can you talk me through what you think we should be doing more?
Yeah, thanks for the question. And certainly, I think maternal health has been and will continue to be one of our most important opportunities and areas of priority. The first thing I would say is that collectively across our provider networks, across our managed care organizations, across our policy, the way, as you mentioned, we've done a lot of investments from both a strategic policy perspective. We are trying to find as many different creative ways to engage and support and provide early maternal health access to our patients. Some of the inherent challenges that exist in the Medicaid population, we know that individuals with lower socioeconomic status tend to have more chronic diseases and have worse health outcomes. We also know that in the Medicaid space, a lot of times our moms are coming to us late in the game. They might become eligible because they're pregnant, but they might not register for TennCare until that third trimester. And so a lot of the work that we're trying to think about is how do we get our moms connected to care as early as possible in the first trimester. And then once they're in care, I think there are a lot of innovative things. I know you've sent us a lot of great information. We've had some wonderful conversations around remote patient monitoring. And a lot of this is, we've created a lot of avenues to allow these innovations to occur. But some of it is also partnering and finding the right providers who are willing to get creative in the way that they integrate these services. Remote patient monitoring is a great example. Telehealth, those types of things have been really exciting to see, but it is challenging sometimes for providers to change their workflow. They're really busy as it is, and they're trying to add in extra activities or extra ways to utilize these new technologies. And it takes a little bit of time for that to get uptake in the market as well. And so we're trying to find ways to both reduce barriers, but also increase the incentives. And so overall, there's a lot of activity, but it's certainly an area where we're really focused on continuing to invest in the maternal health space, and appreciate all the advocacy you've done in that.
Thank you.
Thank you for that answer, and I appreciate the thoughtfulness and your department looking into that, and just hope we continue to do so and continue to find new solutions. Thank you.
All right, Representative Hill, you recognize.
Thank you, Mr. Chairman. First, I would like to start off, excuse me, by thanking TennCare. The HEAL grant, it was an innovative way to take existing funds and assist in the recovery, in immediate recovery effort in the northeast part of the state. And so thank you for undertaking that. I know there were lots of hands on the rope, but I'm sure you guys were at the forefront of that, and I'm grateful for that. My district's grateful for that. And my county's very grateful for that. that effort and that energy. Could you speak to the rainy day fund that's in place as far as the amount, the current amount, what you anticipate in this budget cycle to be added, if anything? And then also, and I'm sorry to throw so much at you at one time, but time is limited. And then the historical nature of how much has been in the rainy day fund over a period of time. Could you go after those three things?
Sure. And I appreciate your comments about the HEAL dollars. And I'll just point out, in those impacted communities, we have 180,000 TennCare members. That represents 23% of the population in those counties. And so, which exceeds the state average. And so there's no question that that is going to help with the health and welfare of the members that we serve in those counties. In terms of our rainy day fund or reserves, I think you're referring to TennCare Reserve. So the budget will be out next week, and we'll see how FNA has arranged everything. But I can tell you, as of last year, we had a reserve of $1.5 billion, but that's not the true reserve because we had about $500 million of that was set aside to address the increased cost during the pandemic. So we had increased enrollment during that time, and because of the federal requirements. And you all may remember, instead of asking for recurring funds to meet those one-time additional costs, we just banked the enhanced federal dollars that were coming in. And then we also have the shared savings dollars that the way that we've, and with your approval, the way that we've appropriated those dollars, the way you've appropriated those dollars is to spread those out over the length of the waiver. So we have a considerable amount of money in our reserve that's obligated for those shared savings initiatives. But when you look at just unobligated dollars, we were at $300 million. So $1.5 billion in that reserve, but if you just look at the unobligated dollars, it's about $300 million. Historically, so that $300 million represents about 2% of our overall budget. I'm looking at data that goes back to 1997. That's really when the TennCare Reserve started. And it's ranged from a low of about, looks like when it first started, we were at about 3% of the overall budget. It got as high as, looks like 8%. But on average, over that time, it's been about 4%. So we're at about 2% now at 300,000. If we were at 4%, that would put us at about 720 million. So maybe does that give you kind of an idea of what you were looking for?
It does. It does.
All right, you recognize.
Thank you, Mr. Chairman. And thank you for sharing that it's a big number in the reserve, but there's obligations that are required. And so it's not as large. It's still a large number, but it's not as large as it may appear. And I would close my time or end my time by again thanking you. This legislature years ago started the block grant program, which turned into the shared savings. The legislature, of course, certainly from my perspective, did its work, but it would not work without the Trump administration, but it also would not work unless you guys continue to innovate and continue to try to look at ways that you can do it in a different way and help as many people as possible. And so I'm grateful to see that it worked out as well and even better than what we thought.
Yeah.
Thanks, Chairman.
All right, thank you, Chairman Williams.
Thank you, Director, for being here. I'm going to try to be quick because Chairman Hicks sits beside me and he's itching to get started in about 2 minutes. So 2031, the end of the block grant. The question is, when do you start making the determination about when you're going to do that? Do you expect, is it something you do 3 years before, 5 years before, 10 minutes before?
Well, so you really have to start negotiating a couple of years before, because certainly you can't hit that end and then you've got nothing. So I would say typically when there's a waiver that's about to expire, we're starting to talk about 2 years prior to expiration.
So in essence, it would be under whatever the next administration would be, not the current administrator, the newest one.
Well, now the caveat there is if we wanted to propose something new, we always have that opportunity. It doesn't mean that the federal government will agree with us, but we can have those discussions.
Yep. Thank you. But just think it's really important for us to know that going forward, because we do have a current administration that was a previous administration that approved it. And if we wanted to change it, tweak it in a small way, just so we could extend that and continue the good work your department and this legislature doing, I think it's really important.
Yeah.
Obviously, I get really bored in the fall, so I get to watch budget hearings quite a bit. So there were a couple of questions I had about budget hearings. One real quickly was the federal match for the community health benefit program. You guys asked for, I think it was a $1.9 million reoccurring investment for that. Could you tell me what that program is for? Or do you remember? Or you can get to my office.
Oh, you want to take it? Yeah. Gotcha.
Victor Wu, Chief Medical Officer. Thanks for the question, Chairman. The community health benefit is really to help support it's really not it's a very old concept that has kind of been moving into the U.S. healthcare system in a really meaningful way around community health workers. And community health workers are trusted individuals who come from communities where they know the landscape, they've lived the experience, and they're helping individuals navigate the healthcare system and actually access care in ways that a lot of those individuals previously hadn't done. We, for the last couple of years, have been investing through grants in developing a community health worker program. This is not just unique to TennCare. There's a lot of other agencies and other nonprofits that are using this space. And so what we're proposing is providing a benefit in community health workers to be reimbursed for those services. We've seen a lot of positive return on investment of that work, and we think there's both the chance to improve quality and reduce costs by investing in that workforce.
Thank you. Just one quick, I had an opportunity to visit a pediatric dental facility in my district. I know one of the important things we did last year that we're starting to see the benefits of is providing dental services to our communities. I think, our children's overall dental health is extremely important. I did notice that you guys asked for some additional recurring revenue there. I do think it's important. I got to see firsthand of the impact that it's making to families, particularly in my district. And so hopefully when the governor rolls out his budget next week, we'll be able to see some continued investment there, because when a parent is getting dental services and the kids are getting dental services, it improves their overall health dramatically. And so appreciate your leadership in that.
All right. Thank you. We are running short on time, so my apologies to other members who did not get to ask their questions. I did want to make a comment. I do appreciate you coming in. And one of the things that I've mentioned previously is about recruiting and retaining physicians, and we are in a crisis mode coming across the U.S., potentially 100,000 physicians short. And so I would like to have you come by my office and have some discussions about as far as what you may be doing to help, particularly in the rural areas, as far as their payments or their reimbursements, similar to what you've done, TennCare has done with hospitals. So I look forward to having those discussions. So, all right, thank you. All right, and we are back in session. With no further business before us, we are adjourned.